Good afternoon, everybody. A few minutes late in starting, ladies. I'm sure it is. It's a bit like going to a Premier League football match. The stadium is empty until about 2 minutes before the kick-off, and suddenly it begins to fill. I wandered around 5 minutes ago wondering whether we were going to have many attendees or not. But well done, everybody, for joining this annual general meeting. A statutory responsibility which we have in terms of the ICB, having an AGM. And I just want to say a few words about it in a moment, but let me first of all make an introduction. I want to introduce Dave Bennett, who has officially joined the board on the 2nd of October, an additional non-executive director for the board, and Dave has a wealth of experience, not least of all as a non-executive director for the Southampton University Hospitals Foundation Trust, and a plethora of commercial and other public sector experience. So you're very welcome. We're really pleased that you're able to join us. And I won't ask people to go around the room. We'll work out your induction programme with you and give you a chance to meet people as soon as practicable. I've got a long string of apologies, if I can just quickly run through them. Alison Bussey, Julian Povey, Neil Carr, Pauline Gibson, Roger Dunshea, and that's a tad unfortunate. Roger, as you know, is the chair of our audit committee, and he would have wanted to have said something about the accounts, but Claire, you'll be able to deal with that in his absence, I'm sure. Louise Barnett, David Sidaway, Sean Davis, and Marianne Grant. Cathy Pert and Cecilia Motley, although actually with the leader of the council here, I'm not sure I would have expected Cecilia to be here as well, but she's always a very welcome attendee at these meetings. So, let me just explain first of all, this is in a way an AGM in two parts. We are undertaking an AGM for the last days of the CCG, if you like, for the last few months of its existence. And we're also undertaking an AGM for the ICB's first 8 months of existence. You'll be relieved to hear there are no papers. If you're wondering where are my papers for this meeting, there are none. But Claire, Skidmore and Simon are going to navigate us through the issues in question, and we're going to have presentations, slide presentation. I think there's also, is there a video as well? There is a video as well, which we will come to in due course. At the end of the meeting, I would normally invite members of the public to raise any questions. We only have one member of the public, and Norna's not really a member of the public in many ways either. She's a member of the support team who are working with us to help us improve our performance. But you can act as a member of the public if you wish and ask any questions later, should you so desire. Now, on that note, I'm going to hand over to... I suppose I ought to do declarations of interest. We have the register, usual ritual. I'm assuming there have been no changes to the register since the last meeting. If there are any that you want to declare, any differences, then please let me know. Otherwise, I'm moving to item 3, which is the annual reports and accounts for, firstly, the CCG, and handing over to Simon first.
Thanks, Chair. And we recognise that a lot of what we're going to talk about has been our business for the past 12 months for everybody sitting around this table. So the intention is we'll move through as quickly and as speedily as possible whilst maintaining our ability to discharge our statutory responsibilities, as you said right at the start, and making sure that we've covered that. As you said, was a slightly strange year because in any annual general meeting, normally it's the full look back on the year and the close down of the accounts and the achievements within that year. But given we've got two organisations, we closed down the CCG at the end of June, established the ICB on the 1st of July. We've had, when I say we, it's the Royal We, finance and audit colleagues have had the joy of two sets of accounts at year end, as well as then the associated audit and review and analysis that goes with that, and the reporting that goes with that. So actually my starting point here would be a thank you to finance colleagues led by Claire. Thank you to the comms and engagement team and the work that goes behind the scenes in terms of the production both of the slides and the work and the presentation in terms of the annual report that's previously been published and the very detailed work that goes about producing two sets of accounts and getting them approved and taking them through the audit process. So important I start with a thank you actually. The other pieces then that we're going to talk about, I am going to go through my elements quickly because we know a lot of this already. And I just recognise that given we are streaming and we're live, then there is us making sure that we explain who we are, even though everybody in this room will know why they're around this room and who we are and why we are here. But the integrated care system and the integrated care board was statutorily formed officially on the 1st of July in 2022. It takes responsibility for buying that range of health and care services for the residents of Shropshire, Telford and Wrekin. It gets in excess of £1 billion of public money to discharge that responsibility and has got a duty to make sure as part of that it monitors the health and care services and has a focus on the quality of care and value for money across the system, but also really clear that that can't be... Are you okay, Paul? You okay, Councillor? Yeah. Must be something strong in that water. And if there is, could you share that bottle around, please? So the other piece, of course, is actually we can't deliver the care across our health and care system without our clinicians and without our professional colleagues and without the colleagues that work in that delivery of services, whether that be from domiciliary care, whether it be the electricians, whether it be the doctors, the nurses, the AHPs, and everybody responsible for that at every level. So I add to my thanks at the start and recognise the work of our health and care professionals across the Telford and Wrekin system for their ongoing and continuing delivery of services to the residents that we've got responsibility for. I've talked a little bit about population and our responsibility and the organisations that we're part that form the integrated care system. I mean, I think all of us would say having a system that has the responsibility, collective responsibility, to sit round a board table and talk about what are we doing that makes a difference for residents is an opportunity that it would be our error to miss. But I also would say that we recognise that at times certain areas of our agenda have dominated more than others, and that's not often allowed us to get into some of those wider bits of how do we really build a partnership. So as well as looking backwards, I think there's a bit of looking forwards to 23 to the year that we're in and going forwards to say we have to move away from reporting on the things that we're challenged with and focus on that, as well as working on the areas where we can work differently in partnership, whether that be with the voluntary sector, whether that be with our local authority colleagues, whether that be with wider community groups, to get to a place where we are really focused on driving improved outcomes, recognising that to tackle those outcomes, the underpinning challenge around health inequalities is one of those main drivers within that. There are a broad range of people around this table, as I've said, and those pictures, you can have the slide after, so you can do autographs of the people that you can see, or darts has been suggested around here, but I'm going to move quickly on through that. So, look, I've talked about current and future challenges, but if we look at our population and we look at where we're at in terms of the ageing nature of our population, if we look at the challenges of public sector funding across the board, local authorities as well as the NHS, if we look at the industrial relation context that we're currently working within, and if we look at the legacy of COVID and the post-pandemic piece of both the impact on children, the impact on adults, work, waiting lists, expectation and demand on services, that's not a mix you would automatically pick and say, yes, please, can we really drive an improvement agenda through that? But you know what? That's the collective challenge that we've got sitting around that this table, and I think that's absolutely appropriate in terms of where we're at with that. I think the strength of what we deliver in terms of improving the population, the health of our population, is through the partnership aspect, and we need to do more of that this year as we go forward. And with that, in all of our plans and all of our strategies, and let's remember this board has signed off the Integrated Care Partnership Integration Strategy. It's signed off the Joint Forward Plan. The messages that are set through both of those are absolutely around how do we look after our residents to stay in their normal place of residence for as long as possible and to stay as fit and well for as many years of their lives as possible. And there's a number of ways that we can do that, and there's a number of ways that we go about that, and that has to be the work that is set out in those plans. How do we mobilise that, and how do we deliver that going forward? Equally, against the context of challenges, then actually there's significant progress being made in a number of areas as well. I'm not going to go through a big list, and I'm looking at that slide, and if anybody can read that, then they've got better eyesight than me in terms of that. But a few headlines, I guess, from this. If we look at the start of the year, what our waiting list profile looked like, and we look at what it's like now, then we've got people waiting significantly less than they were previously, and that is of real benefit to the population that we serve and a credit to our organisations that have delivered that. Equally, if we look at the number of appointments being offered through general practice, they are significantly higher than they were previously, and the recovery of the number of general practice appointments across Shropshire, Telford and Wrekin is really high. If we look at the local area partnership in terms of Telford and Wrekin, assessed as a level 1 for provision of services and outcomes for children and young people, that equivalent to a CQC outstanding, wouldn't have happened without the partnership work across the sector. If we look at the progress that's been made through the hospital transformation programme and taking that through its approval process to the point where we're at now, doesn't happen without the partnership that goes with that. If we look at the work that partners have done in terms of the Community Diagnostic Centre and the elective hub and accessing resource and money to come in to the system to enable that will be the future offer of services to the local people, then it's really positive. So if we look at the progress that's been made in terms of the local care programme and some of our place agenda and the prevention agenda, that some really clear examples that we can demonstrate around the progress that's been made. It's really easy in a challenge system to focus on the things that aren't going right and that aren't working well, but it's absolutely appropriate that we also take the time to celebrate on those areas where we are doing well, and actually where we're setting an agenda that is benefit and appropriate for the residents that we've got responsibility for. There's a number of case studies and examples where we've got that, where we can set that out and demonstrate that. Equally, I've talked about the Joint Forward Plan and the importance of that, and what does that mean and what does that look like. And of course, to drive the Joint Forward Plan, we spent considerable time doing the big health and wellbeing conversation, and there's a short animation that I'm about to play that will explain what we did in terms of that.
As an integrated care system, we are committed to working together to embed a culture of involvement in everything that we do. To improve services, we must effectively communicate and involve the public, patients, stakeholders and politicians. Engagement and involvement are part of every stage in the commissioning cycle. We pay particular attention to hearing from people who face barriers to accessing services and have poor experiences and outcomes. it is essential that we understand our community's needs, challenges and aspirations. As a core part of developing our joint forward plan, we launched the Big Health and Wellbeing Conversation to ensure we took active steps to strengthen public, patient and clinical voices at place and system level. We've developed 10 key principles for engagement which underpin the big conversation. We actively sought people's views and experiences of services, brought stakeholders and communities together to have detailed conversations, involved people early to inform our plans, reached out to those whose voices we don't often hear, and gave people a number of ways to engage with us. We used a variety of engagement approaches to involve as many people as possible. This included holding stakeholder events, public events, a survey, online activity including website and social media, focus groups and community outreach. To ensure inclusivity in our approach, we met and spoke to people of different ages, genders, ethnicities, faiths and backgrounds. We delivered targeted engagement supported by the voluntary and community sector with people who are often the most disadvantaged in our communities. Our ambition was to have 25,000 interactions with people across the county, including online and face-to-face. With the support of all partners and through the range of approaches used, we exceeded the target, achieving 45,068 interactions. Through our public engagement activity, we heard that people have varied experiences and views of our local health and care services. When it comes to primary care, including general practice, pharmacy, dental and optometry, people generally have positive experiences. However, waiting times remain a key concern. Among primary care services, GP service users have the most varied experiences. The availability of appointments is the biggest concern. People want more face-to-face GP appointments and express concerns about transport to get to and from their appointments. The negative experiences of pharmacy services are mainly driven by items being out of stock and no substitutes being available, whilst the negative experiences related to dental services are mainly due to a high cost of treatment and difficulties finding an NHS dentist. In secondary care, the availability of appointments is also the biggest concern. People want more joined-up care, with services working better together and improved communications between healthcare providers and between services and patients. They want to be able to access information about their health and to be supported while they wait for appointments. People also told us that they need support and guidance to care for loved ones discharged from hospital and suggested staff could benefit from training to support people with complex conditions. People told us they value services in the community, and most community services were rated positively. However, there is concern about the decline and lack of local provision. People are also worried about the lack of home visits and lack of palliative and end-of-life care. People want more screening services in the community. They also told us that grants for wheelchair services are too limited. We asked people about their access to the internet and technology, and most people said they have a smartphone capable of accessing the internet and have broadband at home. People's biggest concern about using technology to access health and care is how their data will be stored and used, closely followed by the quality of care they would receive by video call. Those living in areas of deprivation are more concerned about the security of video calls and booking appointments through a website or app compared to those living in less deprived areas. When it comes to self-care and lifestyle changes, GPs and pharmacists are considered the best people to provide advice and guidance. Almost 1 in 5 people who responded to our survey had been signposted to self-care, advice or support to make a lifestyle change in the last 2 years. Significantly more people living in the most deprived areas and people from ethnic minorities had been signposted for support to self-care or to make lifestyle changes. To help people stay well, people suggested free or reduced cost gym memberships, better signposting for patients about where they can go to improve their health, and easier access to screening and medical tests. When we spoke to stakeholders and partners, they told us that staff retention and recruitment and collaborative working are vital. They suggested that this could be achieved with better staff benefits, more opportunities for progression, development and training, pooled budgets, better data collection and use, and increased awareness of the benefits of care closer to home and preventative services. Developing a trauma-informed system also came out strongly, and similar to members of the public, they want people to be supported whilst they are waiting for appointments. So, what next, and how do we plan to keep the big conversation going? The health and wellbeing data and what people have told us will continue to inform our 5-year joint forward plan, and any proposed changes to local services will be co-designed in partnership with residents and stakeholders. We have also established a People's Network for residents to continue the conversation, to talk to us about issues that are important to them and their communities. We now have over 400 members registered. Thanks for watching. If you want more information or want to get involved in the big conversation, email stw.getinvolved@nhs.net. And if you want to keep up to date, keep an eye on the NHS Shropshire, Telford and Wrekin website, or follow us on social media.
Thank you very much for that. And on that basis, I'm going to hand over to Claire in terms of the presentation of the accounts.
Thank you very much, Simon. You can drive if you like.
You tell me next slide.
Oh yeah, I feel like Chris Whitty now. Next slide, please. So, as Simon's already mentioned, it's been a different year for us as a finance team in terms of producing 2 sets of accounts. So the information that you have presented today will give you a 3-month snapshot from the end of the CCG and a 9-month snapshot from the ICB. Just to be clear that these aren't the accounts of our provider colleagues, our NHS colleagues. These are purely for the Integrated Care Board. So you'll see the totality of our billion-ish pounds as a system, and part of that gets handed over to our provider peers to discharge their duties to. I'm really pleased to say that for both sets of accounts we had clean audits, which is great news for us as a finance team, because it's a reflection of the hard work that we put in to capture the transactions and the information that we pull through, but also a reflection on the controls that our staff and teams operate within the system as well. So just reflecting on the CCG first of all, for that 3-month period where we were in operation, the allocation that we received was about £245 million, bearing in mind that we spend that on a population of just over 500,000 people. When you boil that down, that's an average of about £1,900 per person for a full year effect. So that is to cover all of the healthcare needs for that element of our population. We have a small amount of funding on the costs of running the ICB, equates to about 1% of total expenditure. And for those 3 months, the set of accounts that we produced delivered a break-even position, which was slightly favourable against our planned deficit at that point. We'll go to the next slide. We've also broken down where that money was spent. The sort of 50% of the pie chart that you see in that dark blue colour is our hospital services expenditure, so quite a big chunk of our money goes through to acute services, but you can also see relatively sizable chunks for areas of spend in primary care, individual commissioning, mental health services and community. Next slide, please. When we look at the 9 months for the ICB, in a similar way, I'll describe our expenditure. So the allocation for that part of the year was just under £800 million. Again, small percentage, which is on running costs. I think the key message around the ICB position, though, is that, unfortunately, we did deliver an in-year deficit which was beyond the planned position that we had. So our total in-year deficit for the year across that position was £21.8 million. A good percentage of that was driven by the stretch efficiency target that we'd held in the ICB for the system, but obviously there were drivers of overspend in that we will need to address in future years, because that underlying position isn't tenable in the long term. If I just take us to the next pie chart, reassuringly, I think the segments that you see are very similar to the first 3 months of the year, so the proportion of expenditure in those areas remain constant through the year. And again, the largest slug of allocation that we receive through the NHS monies is against those acute services, which remains at about 50%. On the next slide, we've teased out some of the areas of spend and what we actually get for the money that we hand out to different organisations and partners. This is by no means a description of everything that the £1 billion paid for. These are just some highlights to try and make it feel real in the context of what we deliver to our population. So I think key pertinent points for me would be that we saw just over 130,000 A&E attendances through that year, just short of 40,000 ambulance journeys. We issued 9.8 million items on prescription. That's a huge amount. And our GP partners delivered 2.9 million appointments through the year. 500,000 outpatient attendances, and there are other stats on there and others beyond that that aren't even captured. So we deliver significant volume of activity for our population through the various elements of those services that we commission. So just my final slide is a reflection on a look forward, really. So I've described the financial position for the year that's gone and the fact that we delivered a deficit position. We sit here as a board and talk regularly about some of the challenges that we have from a finance perspective. And as I've already alluded to, we do need to make sure that financially we deliver a recovery trajectory to end us spending beyond our means. We've set a plan for the 23-24 financial year for the system of £57 million. Of that, the ICB share is a deficit plan of 11.8 million, so still not breaking even, but looking to deliver an improved position as we move into future years. We obviously aren't standing still on that. We have to look for our long-term sustainability plan, and certainly we have focus in those areas. I suppose the only thing to note at this point is that whilst my part of the presentation is around finance, what I can't ignore is the fact that we have some significant operational and clinical quality challenges in this system. So I look at this through a financial lens for the presentation, but absolutely understand the relationship between our finances and actually delivering high quality services and safe services for our population. So certainly for us as a board, our focus needs to continue to be one of balancing those challenges to make sure that we can address that recovery trajectory but still deliver the best quality services that we can for our population. Thank you.
Thank you very much indeed, Claire. Normally, as I said at the beginning of the meeting, we would probably turn to our Chair of Audit Committee for his reassurance that that the accounts pass muster as far as they're concerned. As I understand it, Roger Dunshares, the Chair, is very happy with the accounts, etc. Can you just confirm that?
Yeah, I can confirm that.
Yeah, good, thank you. So, any questions? Normally at this point, as I said, I'll be looking to the public gallery for any contributions, but over to you as well. Are there any points, any questions that you wish to raise? Yes.
Just make a comment about the community engagement around digital inclusion and that figure of 96% people having access to IT, smartphones and things. That's 96% of the 45,000 people that you engage with, and doesn't reflect what digital exclusion looks like in Shropshire and Telford. So being confident in that figure, I just wanted to comment on that because it comes in the papers later on at the full board meeting about digital exclusion, and saying that potentially that 96% isn't the reality. But to come out with the good news, and thank you to Shropshire Council and Public Health especially for their support in setting up the digital inclusion network on our first meetings tomorrow, to actually look at what digital exclusion looks like in Shropshire. And hopefully we can extend that to Telford and Wrekin as well, because it isn't just about the skills of people over 65 or not being able to afford equipment and having an iPad. If you can't afford the equipment and you can't afford the broadband, a loan system on an iPad is no good because you won't be able to connect But also, it's not just about 65 skills, it's across all age groups. There's also affordability, there's access, as well as vulnerabilities, including, a lot of scams going on and everybody being told to be aware, and how to manage their accounts where it's to do with their personal details and health as well. So I just wanted to plug the Digital Inclusion Network, but also say I think that 96% is not the reality for Shropshire and Telford and Wrekin.
Thank you. And I was thinking about this as I was hearing about that 96%. Another way of putting it is that's 4% of people, which is a lot of people, who will have difficulty getting access as the 96%. I think you're saying the same kind of thing. What we need is strategies for helping make sure that that gap is closed as far as it possibly can
You
be.
really need to understand what digital exclusion means locally, I think.
Yep, thank you. It's a really important point. Sorry, I've got a couple of questions. I think probably... Are you first, Edna?
Yeah, just responding to that, I think that you make a really good point, and I think when we were looking through all the data, what we were really clear about is, with all of it, is of the people that we spoke to, and we recognise there's going to be a large section of the population who won't engage with us for exactly those reasons, if you said. So I think it's right to point that out, but it's something that we're fully aware of.
Thank you. And Masood, did you want to introduce yourself? Because you've got an item on the agenda in the public.
So I'm Dr. Masood Ahmed. I'm the Chief Digital Information Officer and the Deputy Chief Medical Officer. And take on board everything you've said. I think you've hit the nail on the head. And actually, we have been doing a lot of work in the background. So we've engaged with the national team around the digital inclusion framework, and we had input on that. We've also been looking at that co-production piece and what that means in terms of meaningful engagement. So not just sort of, asking questions and getting the feedback, but actually setting up kind of structures where we have people with lived experience, where we recognise, and it's one of the things that Simon actually emphasised in terms of the digital strategy, is that we have to emphasise that we want to reduce digital exclusion. So those are all in the roadmap, and certainly I'm sure you will be asking me in the future, how are we actually taking that forward in a practical sense? Because I think traditionally the NHS has perhaps not done very well when it comes to meaningful engagement. So it's recognised, take on board everything you've said, and we are taking steps to ensure that we tackle that and address that.
That's great, thank you. I'm sure the digital inclusion, I keep looking at this because it's Rachel Robinson, Head of Public Health in Shropshire Council, who's kind of supporting this. It's not here today, but we'd love to feed into that work as well as the partnership, the network.
Thank you. Now, I keep looking around the table and I see mics with a red light on, which I naively assumed meant that somebody wanted to speak, but given that Trevor Macmillan's mic is on red and he's not here, I'm obviously wrong
all on red.
about that. Yeah, are they all on red?
They're all on red.
Are they all on red? Right. So maybe I need a bit of digital expertise training as well. Tina, did you want to come in?
Yeah, I'm just speaking to these things. Can you hear me?
Yeah.
Thanks for the presentations. I think we've heard quite a lot about some of the really good work that's gone on over the last year, which is really positive, and we've heard about some of the challenges. It's a question for us as a board, I think. Were there any missed opportunities last year to work better together? And if there were, how do we learn from that and going into this year to work better together? And it's perhaps an unfair question because it's a rhetorical question, really, and one we should all be asking ourselves. But I just wondered,
Okay,
whether we've missed any opportunities.
I think we have, personally. I think the discussion we've been having about provider collaboration, for example, demonstrates that we believe we can do far better by working together and focusing on a joint view about how to improve, more and more a joint view about how we might improve. But we have ideas and plans about how that should move forward, and let's ask ourselves that question about that issue in a year's time. I think we need to do that beforehand because we need to start seeing some kind of improvements. But that's the one that kind of immediately features in my mind. There'll be others as well. But Simon, did you want to add anything?
I don't think it's just about providers collaborating more. I think that's absolutely right. But I think there's the element of the good work that we've seen through the video around big conversation, but for me there's a and so what, and how does that link back to the wider system in terms of its informing. I think you brought out a question around digital as one example of that, but I think that actually is making sure that from a strategic commissioning point of view, the message is heard at an ICB level, and then there's the and so what, because
yes.
we could end up doing all of our own engagement with the public, local authorities engage with the public all of the time, as do various organisations, and that can be a bit bitty. And from a public's perspective, it can feel a little bit joined up, particularly when you've got one part of the NHS, for example, talking to members of the public, and another part, and understandably sometimes the public will say, well, aren't you all part of one system?
Yeah, I think that's a fair point. My part of my response to that is we already know what we need to do, and in parts when we know we're not doing it well enough, and we know that there are areas of enhanced collaboration between providers and others that need to be driven forward to bring about the kind of improvements we seek. But that's not the end. The point you're making is that's not the end of the story, and I take that point entirely. What I was really impressed with is the fact that we managed to make 45,000 plus contacts through the big conversation. That is impressive, but Patricia raises an important point. There's an important expectation management. There's no point having the conversation, getting lots of contacts, lots of good contributions, if we don't do anything with them. And that's a matter for us all to give some further thought to. I take that point entirely. Are there any other...
I don't, no, it's okay. I don't want to leave, because I think, Tina, your question is a good as rhetorical, but it also so a good one to look forward to, actually, to think about how do we want to work and what does that look like. So we all know each statutory organisation has its statutory responsibilities that it needs to discharge and do, whether that be through consultation, engagement, whether that be how we do deliver change, how we work with partners. But actually, if we think about the agenda we've got, whether it be today or at future board meetings, actually asking ourselves that question of how is it better, how would this be better if, and what does partnership look like, is probably a really good question for us to use as almost a self-check on. So we're looking at this agenda, we've got whatever pathway or whatever area of work we're focusing on, and actually posing the question to ourselves of how do we add value to this by how we can work differently together and in partnership, and be really clear about that partnership, I think would be a really good sense check for us to use around this table as we go forward.
So let's do that.
Yeah, really, really good point. Any further comments? Any other contributions people would like to make? So let me just then make a few closing remarks. Let me echo Simon's point and Claire's contribution as well, by first of all thanking all of you as board members for your contributions. And I use the board member in the widest sense. As you know, we've got this constitutional position where there are some people who are formal board members and others are attendees, but we try and make sure that everybody feels as if their contribution is equally valuable, irrespective of that kind of status issue. So thank you all for your contributions. It's worth just reflecting in a system like ours about the reasons to celebrate, and there were a number that Simon put up there. We are doing lots of good things, but we know we've a lot more work to do, and we know that there's some basic improvements that we need to deliver for the public. Another observation I would make is that as time goes by, we need to increasingly lift our heads beyond the orbit excuse me, of what some might say is more or less exclusively NHS. ICBs are tasked with a range of responsibilities beyond just healthcare, improving health, making a contribution to social and economic prosperity, working more closely with the local government. I think we would all agree that in our formative days, the first year, we've not been able to give that a great deal of attention yet. We have in parts, and I'm very grateful to, for example, the two public health directors and the work that they've done to assist us with this. But I think that's an area where we need to find a means, create the headroom whereby we can think about that more fully going forward. And I hope in a year's time, when we get our next annual report, we'll have some more things to be able to report in that respect. But thank you for the presentations, Simon. Thank you for the accounts and confirmation from the Audit Committee that they are in order and acceptable. And I'm grateful to the member of the public for joining us. And I declare the meeting closed. And in about a quarter of an hour, we'll start our routine business meeting in public. Thank you very much indeed.